Well, good morning, everyone. Once again, how are you? Welcome to another live this morning. And good to have you on with us now. And let's say hello to a few people. I'll try and get where you don't go up into the clouds so much. Michael from Norland, you're number one. Andrea, let's see if Brahim makes the three. Yep, you guys. I don't know how you guys do it. Amber from New Jersey, well, welcome to the top. Nativity at the top. Rosa, Montreal. Jude from Troy, New York, right at the top. There you are, Kevin. From Oshawa, John, how are you? Janice from Brampton. And Denise from Chatham, Kent. Nick from our staff. Near the top, Madeleine, Kippawa, Quebec, bonjour. Fran from Orangeville, how are you, Fran? Yolande, how are you? Bonjour. Rebecca, Calendar, Patricia, Calgary, Bruno, how are you? Diane from LaSalle. And Georgie, Halifax, Nova Scotia. Cheryl, West Virginia. Elaine, good morning. And who is that there from Saskatchewan? I couldn't see it. Wendy from Markham. Janine, West Kelowna, British Columbia. Bonnie from Blenheim. Lorraine. Mike says Brahim didn't cheat today. Hi, Keith. How are you? And from Florida, who was that, John? You know what? Let me try and bring it over again. Kelly, how are you? Diane, Thunder Bay. It seems when I put it under my chin. Wanda. Patricia from Florida. Okay. Lynn Marie. And Melika from Stouffville. Shediac, New Brunswick. Who is it? I couldn't see. Nina, how are you? And Jean, and Arlene, and Elaine. Who is that from Oshawa? Derek, how are you? Lynn Marie, Arlington, Minnesota. Judy, Port Perry. Adeline, how is you? Kelly in the big white clouds, I know. And Leela, I think I caught you, didn't I? Delinda from North Bay. Maggie, how are you, Maggie? Long time no see. Judy and Sharon from Kansas. Judy saying happy birthday to Kathy. Sylvie and Denise. Couple of more guys and we'll get going here. Cecilia, how are you? Cheryl and Karen. Temiskaming Shores. Beautiful. Etta. Nice to have you on. And Debbie from Comox, British Columbia. Marlis. Golden Bay, Manitoba. Sharon. And guys, I feel terrible when I miss you, okay? Maureen, how are you? And Cheryl Scroll. Okay, here we go. Guys, here we go. Ready? Okay, Rosalinda is in the clouds. So, Sandy, how are you? And Maureen, Penticton, British Columbia. Faye. Guys, you know I want to say hello to all of you. I hate to miss anybody, but here we go, okay? Now, this was posted this morning, okay? I just flagged it. And maybe we'll talk about a couple other studies that I wanted to talk about. But I flagged this posting, this article this morning on... they were making a point. People are in like you're hearing on the news, there's an outbreak of measles going on, right? And we're just coming to the end of the flu season, okay? So, and I don't want to talk about the flu shot or whatever, or the vaccine for measles. It's not the point I want to make, okay? It's just amazing to me, though, that this stuff hits the news, okay, like the measles outbreak. And people get scared. The media is into scaring people about measles, okay? And, but the media really misses the big picture. They really miss the big picture, okay? And again, I just flagged this. I'll give you some stats, okay? Diabetes kills this is just the United States, guys, okay? This is just the U.S. The diabetes kills 1.7 million people a year. So 1,700,000 people a year die from diabetes. And that turns out to be, okay, 4,658 deaths in the United States a day from diabetes, okay? High blood pressure kills 7.5 million people a year. High blood pressure. 20,548 people a day die from stroking out or a heart attack from having high blood pressure. Okay? Obesity. 2,800 people a day. Okay? A year. Sorry. 2,800 people a year die from obesity. That's 7,000. Okay. No, I got this wrong. 200,000, not 2,000. 280,000 people in the USA die a year from obesity. That's 7,671 people a day. Okay? And what am I trying to say? Okay? Because the news, they're talking about measles. They were talking about the flu. And I'm not saying we ought not to take that seriously, but in comparison to our elephants in the room, it's craziness. And I've always told my patients, okay, when I was in practice for all these years, I used to tell my patients, don't ask me about getting a flu shot. Don't ask me that, I won't answer. My college, okay, when I was in practice, they didn't want me talking about vaccines, and they didn't want me talking about the flu shot, okay? When I had a radio show, the CRTC, they didn't want me talking about the flu shots. They wanted me talking about vaccines. If I did, I was in trouble with them. I mean, I could say, go get a flu shot. They'd be happy with that. But I couldn't say, I don't recommend a flu shot or the measles vaccine or whatever. I couldn't say it. And the point is, I don't care about saying it now because I'm not so interested in telling people what to do with their bodies in the sense that, but I'll always tell you how to take care of your immune system and do it for yourself. Okay? I don't need to cross any lines. I don't need to. I didn't talk about that in the sense that I said, I don't care what you do, but here's what you need to do in terms of your immune system. You better take care of that. And if you're not taking vitamin D, you're making a big mistake. If you're not taking probiotics, you're making a big mistake. That's all. I used to say that. I said it for almost 50 years. You don't take that stuff? Well, that's up to you. But I don't care what kind of a flu shot you get or a vaccine you get. Like, if you don't have a good immune system, you're in trouble. Okay? So that was the immune system. Always talked about vitamin D. And I always talked about, look, one of the most important vitamins you need for your immune system, vitamin D for sure. People thought vitamin C, I said, yeah, I'm not against it. But the real vitamin C is coffee, but you need vitamin A. Because vitamin A would cover, it gives you the invisible mask covering your eyes, your nose, and your mouth, vitamin A. How do you get vitamin A, Doc? Eggs, meat, and cheese. I didn't even care if you took vitamin A. I wanted you to eat vitamin A, but a lot of people don't eat enough vitamin A. Vitamin A is found in the animal kingdom. Beta-carotene is not vitamin A. It's a precursor to vitamin A, but it's not vitamin A. So when you eat your carrots, okay, but that's not giving you what your immune system needs, and that's vitamin A from eggs, meat, and cheese. Eat your steak and you get lots of vitamin A. Did you know that? Okay? Yeah. It's found in the animal kingdom. Proretinol A is in the animal kingdom. Now, okay? So that's the immune system. But what about the elephant in the room? Why isn't the media concerned about in metabolic syndrome? Listen. Okay? Which is a combination of some of these things. High A1C, high triglycerides and low HDL cholesterol, belly fat, elevated blood pressure, elevated, like I said, A1C, elevated, and you know me, I put two more, elevated uric acid and low levels of vitamin D. That's metabolic syndrome. You know what the world tells us? Statistically, 30,000 people a day die of metabolic syndrome. You combine it. A day. Of one of those factors or all of those factors. Because they have problem with insulin and insulin resistance. And yet, the world doesn't want to talk about that. They're much more infatuated with a virus or the measles or the flu. And, you know, like public health agencies. I want to scream because, you know, it's crazy. Okay, so when I hear, oh, the measles is around, okay. I got the measles as a kid. You know, I got the measles. I remember. I remember it like it was yesterday. And did I feel good? Nope. Not at all. I was sick. But you know what? The measles develop your immune system. And once you get it, you're immune to it. Okay? And that's what your immune system is supposed to be. Like when people tell me, you know what, Dr. Martin? I never get sick. Never, ever, ever. I said, you just be careful. Don't boast. Look at your immune system. Every once in a while, a bug will come and give you a hammer over the head. And you know what? Your immune system needs to be charged up. I remember patients coming into the office, and I used to show them in their blood. One of the things that I loved doing was live blood. Okay? Now, it's not everything. And look, you guys know what I think about blood tests. I love blood tests. Give me blood tests. I was a guy, I didn't guess. I tested you. You came into my office, test. I did about 30, 40 different tests. And you know me. I wrote about it in my book, Sun, Steak, and Steel. And I got a whole chapter in there on what blood tests that I love blood tests. I love testing. But one of the things I used to do, I used to look at live blood because I wanted to have a look myself at what your blood was doing. Okay. And again, you can go to some practitioners. I used to teach it, by the way. I taught people. I taught practitioners how to do live blood and how to interpret it. And I said, look, there isn't a disease behind every tree when you look at blood. I used to get, because you hear people and they say, well, you know, you got this disease or you're dying because I looked at your live blood. I said, I don't do that. Live blood was never meant for that. Okay? Now you guys, some of you guys might have had this done, even in my office. I liked it because I used to like looking at your red blood cells live, how many you had, what were their shapes. I used to like to look at the serum, what was in it. A lot of people, I could tell if you were dehydrated. I could tell if you had leaky gut by looking at your blood. And I could tell if you had yeast or fungus that was traveling around in the blood, parasites, you could tell that. And I used to show people, a lot of people, look at your immune system. Because, and you guys can go on YouTube and watch this if you've never seen it. Just type in on YouTube, a white blood cell chasing a bacteria. Go do it. It's fun watching. I used to see that all the time in my office. I said, you know what? Your immune system is really, you got a good immune system. They said, Doc, how do you know that? We see your white blood cell there. Look at it, chase that bacteria. You wanted that. And then I would get people and I'd say, you got a poor immune system. I said, because look at that bacteria and your white blood cell is having a siesta beside it. There's a bacteria there and your white blood cell should be chasing it and your white blood cell is asleep. I said, you know what? Can I tell you something? I can almost guarantee now, without even knowing your vitamin D results, you got poor levels of vitamin D. And they go, Doc, how do you know that? I said, because your white blood cells have little antennas and they're battery operated. Okay? They're battery operated. They're an EV, an electronic vehicle. They're battery operated, and the sun supercharges your white blood cells. And secondly, okay, I said I can almost tell you without knowing you, by just looking at your blood, I can tell you you like sugar way too much. What? Well, look at your white blood cells. They're sleeping. Sugar will put your white blood cells to sleep. You have low levels of vitamin D and you have, you eat too much sugar. Oh, I don't, I do it in moderation, Doc. I said, you and sugar don't get along. And by the way, nobody and sugar gets along. You don't. Okay? You might not be a diabetic, but you don't get along with sugar. Okay? I don't care who you are. Your body was never meant for that, especially that high fructose corn syrup. Your body doesn't even know what that is. What is it? Okay? Okay. Now, imagine here we are living in a society. We live in a world, and I've talked to you about this, in a toxic soup, our environment. But we live in a world that, for example, you go to the hospital, okay? Or you go to a doctor's office or go to the hospital. You're a smoker. Here we are in 2025. What will they tell you to do? You got bad lungs. You're coughing. And the first question they'll ask you, do you smoke? Yeah. Well, stop. Stop. Right? Isn't that what a doctor, a nurse, anybody, wouldn't they tell you? Well, you're smoking. Your lungs. You're destroying them. Would they not tell you to stop? Sure they would. I think. They should. Okay? You go to the hospital and, you've got liver disease. They still do this, by the way. Do you drink alcohol? Because you got cirrhosis. Yeah. Well, stop it. You can't have it anymore. Your liver is full of cirrhosis. Stop drinking alcohol. Got the memo? Yeah. Well, you should, right? And yet, if you go to the hospital in 2025 and you have diabetes, they'll feed you pancakes. True or false? It's crazy. Don't smoke, you got bad lungs. Stop drinking alcohol, you got a bad liver. You got diabetes, and they feed you sugar. Or, you know what a pancake is? You know what a pancake is? It's just sugar molecules holding hands. You got a lot of sugar molecules. They're holding hands. When you eat that and you're a diabetic, it's the worst thing you can eat. A piece of bread, just sugar molecules holding hands. Dr. Martin, it's whole wheat, just sugar molecules holding hands. It's 12 grains, just sugar molecules holding hands. And if you're a diabetic, you go to the hospital, they're giving you that. They still, imagine, we're in 2025 and they still don't get the connection, okay, of diabetes and food. It's genetics. It's genetics and moderation. And even today, a dietitian, highly educated, will tell a diabetic patient, you need, because you're on meds. The doctor put you on meds. You're on metformin, or you are on these, injections. A lot of people are on the injections today, right? And, but they don't talk to them about, well, you gotta need some carbs because you can't live without carbs. No, wait a minute. If you're diabetic, you have an allergy to carbs. That's what it is. I used to tell my patients this all the time. I turn around, I got all their stuff. I turn to them and say, you know what? You have an allergy. What? Doc, I said, yeah, you do. You have an allergy to carbohydrates. You and carbs, nah, you don't get along. You might eat them, you might like them, but they hate you. They hate you. I said, I can't help it but tell you the truth. I know I don't like to be the bad news bearer. But I said, I'm trying to save your life. Well, my doctor said, well, I know, but you might as well have gone to your plumber to ask your doctor about nutrition. I'm sorry. You have a food disorder. That's what diabetes is. It's a food disorder. And, they'll tell you to stop smoking. They'll tell you to stop drinking, but they won't tell you to stop eating carbs. And they should. And they should. We're in 2025, folks. Right? You're a diabetic. You better cut back on butter. Well, what the heck does that got to do with diabetes? Oh, cholesterol. Because when you're a diabetic, every doctor knows this. Oh, you're much more susceptible to a heart attack. You're much more susceptible to cancer. What? Why would a diabetic be much more susceptible to cancer? But they are. 50% more likely to die of heart disease. Well, 80% more likely to die of heart disease. Diabetes, I always used to tell my patients, okay? I said, you're a diabetic, okay? And a lot of times I had to give them the diagnosis. Some of them didn't even know it. I said, well, you're a diabetic. What? Well, you're peeing out sugar in your urine. I don't care, but I do care, but I care less, okay, about your blood sugars, unless it's an A1C. I like that. But I said, at the end of the day, diabetes is the last thing to happen. But if you're peeing out sugar in your urine, you're a diabetic. 100%. So listen up. You want to save your life? Go home, kick the can, because you're mad at me for telling you this, okay? Kick the garbage can, get mad for about 20 minutes, and then grow up. Look yourself in the mirror. Don't deceive. You know the worst deception is self-deception. I see it all the time. They just fool themselves. Dr. Martin, he's over the top. Dr. Martin's over the top. He's exaggerating. Okay? And diabetes never, ever, ever ends well. Diabetes will kill you. 100%. Diabetes, you let it go, you're going to lose your eyes, you're going to lose your kidneys, and you're going to lose your limbs. And it's a food problem. Okay? And here we are today. Diabetes, when I was a kid, okay? I've told you the story. My grandfather, the founder of the Martin Clinic, was a diabetic. That was so rare in the 1950s. It was, I saw a statistic the other day, it was 1 out of 50,000 people or something like that were diabetics in the 1950s. I mean, my grandfather was one, though. I knew that because my dad used to tell me. And then my dad, diabetic, 1968, diagnosed. Okay? Diagnosed. What did I know? I was 16 years old. Okay? But boy, I learned fast. And I've been sort of a diabetic guru for a long time. Like I said, I got trained by the best, my dad. Son, it's sugar diabetes. When you look at bread, bread is just sugar molecules holding hands. That's all it is, guys. I know the old-fashioned, in the Bible, bread. They don't make bread like that anymore. Okay? And when you're a diabetic, you can't have it. Go home and, like I said, get mad at me, kick the can. Dr. Martin, he makes me so mad. I can't get over how he insulted me. He said I have an allergy to carbohydrates. And when you get mad and then get over it, look in the mirror and say, you know what? You there in the mirror, you, me, you know what? I'm going to listen. And, you can get on meds if you want. All that's going to do is put a Band-Aid on it. Meds will never fix your diabetes. I'm sorry. It will never fix your diabetes. Okay? It just doesn't. It's a Band-Aid. And you need to change your diet. It's as simple as that. And people that do, I had tens of thousands of people over the years. They listened, Linda. They listened. And even today, okay, I guarantee you I'm going to get some feedback from someone. Listen, we got over 5 million downloads on the Doctor Is In podcast. And we got, is it 89,000 followers? I can't wait till we get 90 on Facebook. 89,000 and change followers on Facebook. I get a lot of feedback, guys, over the day and every day. And I get people saying, you know what, Dr. Martin, I want to thank you just for being honest. Okay? I didn't like what you said, but I took it to heart. Yeah, I didn't necessarily get a lot of joy telling you, but what kind of a person would I be if I didn't tell you the truth? Right? And in nutrition, the truth will set you free. It will set you free because you get it. You got the memo. You said, yeah, okay. And I know it's going to go against the grain. I know that there's going to be every guru in the universe, just about, will tell you that red meat will kill you. Eggs, be careful. Cheese, oh, that's fat. Yeah. No, that's the best food you can eat. If you have any issue with metabolic syndrome, if you're 93% of the population that has metabolic syndrome, well, you and carbs don't get along. That's all. It's an insulin thing. It's insulin resistance. It's food. Yeah, there's other factors, like stress is a factor. And, the environment is a factor, but it's not the big thing. What are you going to do? Here's what you can control. Today, here's what you can control. What am I going to put in my mouth today? What am I going to eat today? Yeah, that's what you're in control of. You're not in control of much else. The environment, good luck with that. I always tell people that. I said, don't fret, Don't sit there and think about, oh man, where could I go to get away from this, the pesticides and the herbicides and the plastics and the xenoestrogens. And look, you can do everything you can in your home and try and clean up and do everything you can. I'm not against that, 100% for it, as a matter of fact. But at the end of the day, you better take care of your immune system. If measles come around, what do you got to worry about? If the flu comes around, what do you have to worry about if you take care of your immune system? And don't be part of the stats on diabetes. And it's reversible. You'll always have a weakness, but you control it because it's controlled by food. And like I said, don't wait till medicine catches up to what I just talked to you about today. Don't wait, please. Okay? You got to understand, there's an industry, there's a pharmaceutical industry, big pharma hijacked medicine. They hijacked it. That's why they don't teach nutrition in medical school. They leave it to dietitians. They have a profession that does food. And even the dietitians are hijacked by the big foods. Big food, big pharma, big food, big pharma, trouble. And they do some good things, okay? They do some good things. But big food, big pharma, they hijack medicine. They hijack the medical schools. They own them, lock, stock, and barrel. And the dietitians are owned by Pepsi and Coca-Cola and Kraft Dinner. Ugh. That's why you still hear moderation. Even though we got a crisis of diabetes and metabolic syndrome and high blood pressure, hypertension, and obesity. Moderation. That'll do it. No, it won't. But like I said, I am not waiting till this is accepted in the mainstream. No, I won't wait. I know what's right. You know what's right. You doed it. I have one of my grandchildren. They used to say that. I doed it. Okay. You know how kids, they want to do it. I doed it, Grandpa. Okay. You do it. You doed it. But you doed it too. Okay. You know what to do. Okay. We love you guys. Listen, tomorrow, okay, get the memo out. We'll post it that I'm traveling tomorrow. So no program tomorrow. Friday back live Q&A. So get your questions in. Friday live. Okay, back. Tomorrow off. Okay, traveling. Okay. Love you guys. Talk to you soon.